Understanding self-injury behavior in autism. Information gathered and interpreted by enabling autism. Disclaimer. These information are not of ours and we are not claiming as ours. We read through many articles from credible sources and extracted what we think is important for parents to know. Our opinions should not be taken as professional advice nor treatments. Always consult with your child's behavioral therapist, specialist or doctors for advice. We simply gathered in the information for parents and provide a readout of the information. Before we start, please support our effort in gather information to parents and creating learning contents for autistic children. Simply subscribe our channel and like our Facebook page. Thank you so much. Let us get started. Understanding self-injury behavior in autism. Self-injury behavior, SIB, is defined as any action that puts the individual in danger of suffering physical harm. There are several reasons and disorders why people commit self-injury. This article focuses primarily on SIB in children on autism spectrum. Some autistic children may hurt themselves in a variety of ways, however, the intention is not to harm. It is the outcome of an effort to control, express, or communicate an instant physical pain or discomfort or a specific demand. Self-harm, which is not a focus in this article, is the deliberate infliction of physical pain or suffering upon oneself, frequently in an effort to cope with distressing or challenging emotions. It's also known as non-suicidal self-harm, and the behavior is more severe. Behaviors comprise, but not limited to, slapping, hitting, scratching, biting, head-banging, pulling hair, pinching, cutting. This behavior might not be an autism symptom. However, some children with autism may resort to self-injury due to certain symptoms and circumstances associated with ASD. According to a recent study, approximately 1 in 3 kids on the autistic spectrum engage in SIB. This behavior can be especially terrifying since it appears to go against our primal desire for self-preservation. Parents child-proof their homes and implement many safety measures to safeguard their kids from the world. But how can they project against a threat they pose to themselves? For families with children on the autistic spectrum, this is a major issue with no easy solution. SIB can be avoided, and the long-term impacts of this behavior can be reduced, by treating underlying illnesses and giving the child support in learning new communication and coping mechanisms. Why do some children with autism engage in self-injury? People often view self-injury in terms of its effects. A child may suffer a lasting injury, and a parent may feel demoralized or overwhelmed, and strangers may not understand. While these effects can grab attention, focusing on them is unlikely to address the underlying issue. Parents and specialists aiming to help a person diagnosed with autism who is engaged in SIB should start by investigating triggers that lead to the behavior. Often SIB can begin accidentally and, when it's inadvertently reinforced, it can become a learned behavior. In many cases, SIB serves as a means of communication. Often a child is trying to self-soothe or convey a feeling, idea they may not be able to express in words such as, "I'm in pain," "I'm in discomfort," or "I don't want to be here," "I don't want to do this," or maybe simply, "I want to play." Other factors that may be major components. Sensory differences trying to regulate, manage sensitivity to sound, light, texture and touch. Difficulties recognizing, managing, and regulating emotions, alexithymia. Difficulties with transition between environments, home, school, daycare. Being around others who self-harm. For common causes. Response to pain, many physical problems such as headache, stomach discomfort, relates to bowel movement, can lead to SIB. Many parents are confused about why a child would inflict more pain if a child is already experiencing discomfort. They fail to understand the significance of distracting themselves through this behavior. It's important that parents understand the significance of recognizing self-injury as a distraction from pain. Expression of frustration. Parents often see their child exhibit SIB as a result of frustration. Usually this is the result of the child's lack of communication abilities. They may be unsuccessfully trying to explain something, or the child might not understand what is being asked of them by the adults. Whatever the reason, the inability to communicate leads to frustration and then SIB. Avoidance. Autistic children can also engage in SIB to avoid or escape an uncomfortable situation. The children may start to injure themselves to avoid something or someone. As an example, parents ask a child to put away their favorite toys because it is time for bed. If he does not want to, they may then engage in SIB to avoid the request. The result is the parent's initial request is dismissed because now they are focused on stopping the destructive behavior. Self-harm due to sensory processing issues, overload, deficit. When children with autism experience sensory overload, noise, visuals, smells, and tastes, sensation of self-injury such as head banging is one they can control and on which they can place their focus. Autistic children might also experience sensory overload, deficit in the moment they are unable to communicate their needs. Children that are overloaded due to sensory processing issues often self-stimulate, commonly referred to as stimmying. Children who are understimulated, seek attention, or bored might self-injury to stimulate their systems, even if they know they will not receive positive reinforcement. Why self-injury behavior is so hard to break. It is important to remember that the child is not acting with malice, and neither is the parents or caregivers. However, more often than not, self-injury is a learned behavior. Parents certainly don't intend to teach children to engage in self-injury, but they may unintentionally reinforce the behaviors. If the child engages in SIB and the adults give them a treat, electronic device or preferred toy, the child quickly learns that SIB leads to achieving what they want. On the other hand, if the child engages in SIB, and the parent immediately removes them from an overstimulating environment, they learn that self-injury can help them avoid uncomfortable situations. In both cases, the child is attempting to communicate very real wants and needs. When the behavior achieves the result they wanted, they learn to associate self-injury with a positive result. If SIB achieves their goals, then unfortunately, they are likely to continue the behavior. Treatment options. Ideally, all treatments should be delivered by a professional with a good understanding of autism. More importantly, support should be adapted to a person's specific needs to make it effective. You can work with your child's doctor for any treatment with medication or applied behavior analysis specialist for the right response once the underlying reason is clear. Therapy option. Working with your child's behavior analyst, psychologist, or occupational therapist, OT, who has experience in treating self-injury. Early intervention is necessary to remedy SIB before the behavior will become chronic and severe. It is vital for parents or caregivers to seek professional help to correctly resolve autism and SIB. Many children find sensory therapy with an OT to be helpful. Others have found yoga and rhythmic therapy in conjunction also help with SIB. Medication option. It is not advised to use medication as a treatment to lessen self-injury. However, if other choices have been tried and come up empty or when the behavior worsens, you should speak to your child's doctor. For the treatment of underlying depression or anxiety, you might be prescribed medication, such as antidepressants. Antidepressants are generally regarded as helpful and safe, however there is limited information on whether they may be used to treat depression in autistic individuals. According to the available studies, autistic people may be more susceptible to adverse effects such as drowsiness, irritability, and decreased activity. A medical expert should carefully consider antidepressants and keep a close eye on them. Some people hypothesized that CBT could aid in SIB. Home remedies option. For parents and caregivers, in-home strategies can take many forms and will most likely be a process of trial and error. It's important to determine the underlying cause before you can remedy it. Disclaimer: these should not be taken as professional advice nor treatments. Always consult with your child's behavioral therapist, specialist or doctors for advice. First, you need to make sure your child does not have any other medical issues that would lead to them inflicting harm. Ensure the child is not in pain or being discomfort by checking your child's body for cuts, bruises, redness, swelling, or other physical signs of injury. Keep an eye out for ear infections and stomach ailments because those are not easily detectable. Working with a communication specialist or establish a communication method to help your child show you where he is experiencing pain is very helpful. For verbal children, teaching short phrases and keywords to prompt adults when in pain. For nonverbal, draw a picture of what hurts, communication board, visual cues, or sign language should be used. Role-playing to show the child to communicate instead of SIB when being hurt, discomfort. It's important to stick with one communication medium for consistency and be sure the child has access to this communication system at home, school, daycare. If the child begins to injure themselves following a request, responsible adults should block the behavior for safety reasons. However, they should continue to follow through with the request, so the child does not learn that SIB gets them out of an activity. If a child hits themselves for the first time, parents should maintain their composure and stay calm. Avoid taking any action that would reinforce the behavior. Try to calmly stop the behavior if it is serious or the child might be hurt. Create a redirection or distraction when it is safe to do so. Focus on the appropriate, desired conduct through communication and compliance rather than the SIB itself. Dietary supplements. Thousands of parents who have given their kids vitamin B6, calcium, or dimethylglycine, DMG, as reported by the Autism Research Institute in San Diego. These parents often noticed rather dramatic reductions in SIB, and in some cases, its complete cessation. Parents have also noted improvements in their kids' severe behavioral issues shortly after putting them on a limited diet, such as a gluten or casein-free diet. Parents can provide accommodations for overstimulated child. Items such as noise-canceling earplugs or headphones. Create a safe space for the child. Using sensory clothing. Playing with toys, sensory toys. Develop communication skills. A weighted blanket, a well-secured bouncing chair, yoga ball chair, or rocking chair.